everyone to another episode of Ask Nutritionist Deepa. And today I feel so fortunate and really so rewarded because I have with me no other than Dr. Stephen Lome, who is a cardiologist. Uh, of course, he's a cardiologist, a well-known cardiologist, but in my heart he has a special place because he treats his patient using food versus the traditional methods that are used to reverse coronary artery disease. Dr. Lom, welcome to our episode.
Thank you very much, and thank you for having me.
Dr. Lom, I know you have been working with OSF healthcare system in Peoria, Illinois, currently. Is that right?
Yeah, that's correct. Peoria and Ottawa and Peru, Illinois, yes.
Okay, perfect. And everybody, before we get into the episode about the heart issues and everything that's going on, I think Dr. Lome's personal story about what he's doing and why he's doing and his journey into plant-based nutrition is amazing. So I'm going to open the episode with that because we all love stories. So here we go. Please tell us, please enlighten us, please motivate us with your personal story, Dr. Lome.
Sure, absolutely. And it actually kind of comes from two different angles. One was kind of on the personal side, growing up in a standard American family, and the other is on the professional side, getting the standard Western medical training. So initially I grew up, with a loving family, eating the typical standard American diet, burgers, fries, hot dogs, a lot of processed foods, a lot of animal-based foods. And yeah, there were some vegetables in there, but they were usually cooked with butter or oil, not always in a healthy way. And really didn't think much of it. We ate what our culture told us to eat, what our food system provided us, and what tasted good and what was convenient, just like what most Americans eat. And unfortunately, as we know, the results of that is 80% of America being overweight or obese and diabetes and heart disease everywhere. But we didn't have that mindset because we just did what everybody else did, following the standard American diet. Now, on the other side, professionally, I trained at a major academic university, and I learned everything about every single medication you could possibly think of, putting stents in coronary arteries and doing open heart bypass surgeries and such. And honestly, I didn't realize this as I was going through it, but I really had zero training in nutrition. And the only preventative medicine type training we had was when to give the cholesterol medication or when to give the blood pressure medicine. It was all medication related. And it didn't really hit me how ineffective that truly is when you don't treat the cause of a person's problem. And so I had been a cardiologist in practice for about 4 years at the point in time where I had my big revelation. I personally, following the standard American diet, got up to about 260 pounds, and I started, having issues. Blood pressure was going up, acid reflux, my back was hurting me, I was getting tired, sleep apnea. I just couldn't keep up with the kids. And so I kind of woke up and had my own little aha moment that I had to get my own health in order. And that's when I realized I don't know anything about nutrition or weight loss. And even though I'm a doctor, whenever a patient would ask me about eating healthy, I would give them the generic, vague answers. Just, don't eat at McDonald's too often, or, try portion control. But I really didn't know what I was saying because I had no formal training in this. So I had my own personal aha moment.
So can I interrupt you? So
yeah.
What was that aha moment? I mean, obviously you didn't become 200 plus pounds overnight. It was happening over a period of time, and that happens to a lot of people. But what was really something that hit you, like hit you in your face, basically?
Yeah, some people have that one event where they have a heart attack or a loved one has a heart attack or God forbid. And that didn't happen to me. I didn't have any one specific event. I just remember feeling tired, feeling lousy, and just thinking, wow, I could see myself developing these chronic diseases that I have, all my patients in front of me are having. I remember one moment walking up a flight of stairs, carrying a box that was no more than like 10 pounds, and just stopping at the top and saying, oh my gosh, I'm so short of breath. I can't believe I couldn't even walk up one flight of stairs. I'm 35 years old here and I'm having a problem. And so there wasn't one event, but it was just a culmination of all those things. And what was interesting is how it really coincided perfectly well. The timing was great with my frustrations as a physician. because I was, in practice for 4 years, I was clearly seeing that I can give my patients all the right medications for blood pressure, cholesterol, give them the blood thinners, all these things. And I knew people didn't like the medications. A lot of times they didn't take them. They had side effects. They cost money. And even if I gave them all the right medications according to guidelines from the American Heart Association and the American College of Cardiology, like I was trained to do, they might still have a heart attack. They might still have a stroke. And I was just getting frustrated. Like, really, is this what I'm going to do? My whole life is give people pills and wait for them to need a stent or a bypass surgery. I knew something was off and wrong, but it didn't quite hit me what it was. And it was so random that Netflix said, hey, you should watch this documentary called Forks Over Knives. And it really, really hit me at that point, because I had that aha moment. And I went 2 years trying to get rid of processed foods and eating my chicken and fish, low-fat dairy products, olive oil, because I read those USDA dietary guidelines 3 times over, and thinking the government's not going to lie to us, right? The government's got to be legit, with their guidelines. And unfortunately, that's not necessarily the case, as we've come to find out. And I lost some weight through moderation and exercise, but it was frustrating and challenging. Not as much weight as I wanted. I really wanted to hit my ideal body weight. And when Forks Over Knives hit, which many of your viewers and listeners are probably familiar with it, when they say cut the animal products, cut the oil out, and definitely dairy should be gone, those were completely new concepts to me. A plant-based diet was nowhere at all in my mindset. And so when I did it, I lost so much weight so quick, saw my cholesterol numbers plummet, my energy level go up. I've run 7 marathons now. And it's just been such an amazing thing. And so as I took those nutrition concepts that I learned, not just through Forks Over Knives, but I independently went through all the nutrition data and research and guidelines and self-educated myself, because it was like going back to medical school again. I didn't have this training. I had to learn it all on my own. So I went to so many different nutrition conferences. I got certified by eCornell, plant-based nutrition and such. As I started implementing these things in my practice, oh man, did it make such a difference. I finally have patients.
Did you just, I know you are a busy family, you have young kids and very robust career. What did you do? You just stopped eating meat? I mean, you just started buying salads and cooking? I mean, how did it work?
Yeah, it's a good question. At that point in time after I saw Forks Over Knives, I had already developed kind of a skill set. I took the time to cook and food prep myself. I was bringing lunches, but it was boneless, skinless chicken breast with vegetables doused with olive oil, and I was still doing the low-fat dairy products and such. So I had already kind of done the food prepping and developed some willpower to get rid of some of the processed foods. So I was already, thank goodness, in control of a lot of my prior unhealthy habits, the eating the donuts and the processed foods. I was able to eliminate that. So when I decided, hey, this is definitely the right thing for me, going plant-based, I really, within about 48 hours, I was able to transition to 100% plant-based. It was as simple as just, instead of cooking a bunch of chicken breasts on the Foreman grill, I just got a bunch of beans and I made some bean dishes, and I food prepped bean dishes instead. And instead of putting olive oil over the vegetables, I used other spices and seasonings and such. And of course, just stop buying the milk. And so, yeah, waking up, it takes some time and effort. It's a skill, so you got to put the effort into it. So I woke up early. I cooked in the morning frequently, and it was a challenge, but it was worth it, because when you're talking to a patient and I'm saying, listen, I think you need to make some diet changes, and a plant-based diet is the way to go, they're almost always asking, do you do this yourself? Yeah. And I get to tell them, yes, I do. Actually, I've been doing it now for approximately 4 years, and I feel great. And I can share with them recipes, because I've developed my own repertoire of the foods that I like to eat and the recipes that I like that are healthy, whole food, plant-based, no oil. And it's just been so great in clinical practice, empowering the patient to take control of their own health. There's nothing like it. Most patients feel helpless. I'm going to take these pills. They're going to bankrupt me. And ultimately, I have side effects. I don't like swallowing them. And I might still have an issue. Versus, wow, I learned the skill set as to how to prevent disease, how to reverse my disease. I now understand why it is I clog my arteries, and I know I have control into it. It's not genes. It's not fate. It's not up to my doctor to give the right pills or tell me when I need another stent in my coronary artery. It's up to me. I have control, and that's so empowering. I have had more patients tell me, thank you, Dr. Lome, you saved me, when I teach them the power of lifestyle medicine and nutrition and other lifestyle changes. I never had that when I was just throwing pills at everybody. It's such more of a rewarding way to practice medicine.
That's an amazing story. I mean, it definitely, uh, adds credibility to you as a person, but as a practitioner. I mean, they are very, I mean, yes, you be like having a cardiologist who is using food to reverse coronary artery disease almost seems like a voodoo medicine if you think about it, right?
It's really, that's a good point. When I first learned about this, I
Yes.
thought, why isn't everybody doing this? Wait a second. This research is legit. Look at Dean Ornish's work. It's
Yeah.
incredible. Why is nobody talking about this? And I thought hard and long about it. And there's multiple reasons. Most doctors don't follow healthy lifestyle. Doctors have nutrition education. They don't get paid for it. Their culture tells them not to do it. Their healthcare systems don't promote prevention because it loses money for healthcare systems. It goes, and then, the other reason 100% plant-based diets aren't recommended frequently is because a lot of the data sits with Mediterranean style diets because that's what's been funded and that's what's been done. But we could talk all about how a Mediterranean diet is way better than the standard American diet, but it's still nowhere near as good as going 100% plant-based according to the data. So there's so many factors involved, but yeah, I really questioned it. And what I thought was challenging is I told all my patients and all my partners about it is a lot of people got it and they understood it. I even converted one diehard cardiologist to 100% plant-based, and now his whole family is, et
Yes.
cetera. However, I did all this before formally the guidelines said to recommend a plant-based diet. As about a year and a half ago, the
Mm.
American Heart Association, the American College of Cardiology put in their guidelines for the primary prevention of heart disease that a plant-based diet or vegetarian Mediterranean style diet is preferred. Which finally now I can say I have guidelines to support everything I've been saying. So it makes me feel better.
That is awesome, and I think that's how the change is going to happen. So thank you for sharing that wonderful story about how you got into this. Now, for most of our viewers and listeners, can you please define when you say plant-based what it means and the difference between the vegetarian or plant-based, or those subtle differences, and the magic whole food plant-based, what does that mean?
Yes, and so that's a great question. It's super important to distinguish what these different terms mean because a lot of them are used loosely and interchangeably, and you don't really know what it means. So vegetarians, of course, don't eat any meat, which usually means they also don't eat fish as well. However, they consume dairy products and frequently eggs as well, depending if they're lacto-ovo-vegetarian or lacto-vegetarian. So, however, if somebody eats a plant-based diet, usually that would mean that they're not even consuming meat or eggs or dairy products. However,
Hmm.
the term plant-based is vague. It could mean mostly plant-based, like 90% plant-based. It could mean 100% plant-based. And so that's where I think things get very vague. And so the terminology I personally prefer to say is exclusively plant-based,
Okay.
or I would say whole food vegan, because a lot of people know what vegan means. Vegan means no animal products. However, many people are vegan more for animal rights issues or environmental issues, which is great and respectable. However, when somebody says they eat a vegan diet, they could be surviving on Oreo cookies, cotton candy, and drinking soda pop, which is highly processed, unhealthy vegan food. So I prefer the term exclusively plant-based, or actually even better would be whole food vegan. So people know vegan means 100% plant-based, no animal products.
Hmm.
And whole food means I'm eating unprocessed plant-based foods, fruits and vegetables, beans, whole grains, nuts and seeds, herbs and spices. So I prefer using whole food vegan or whole food plant-based, or I guess you'd have to say exclusively whole food plant-based, which again, the terminology is confusing, but it's important.
Okay, perfect. So now, this COVID crisis and coronary artery disease.
Yes.
My original intention was not to have you on the podcast. I was nowhere near this pandemic, but here we are. And one of the main risk factor seems to be the coronary artery disease, hypertension. What is going on there?
Yeah, so indeed, what the research is clearly showing is 94% of people who end up dying from COVID have some form of chronic disease, whether it's heart disease, lung disease, chronic kidney disease, hypertension, diabetes, obesity. 94% do. And certainly it leans more towards the heart disease, hypertension, and then the lung disease issues, which predispose people to having worse outcomes with COVID. And so honestly, what us lifestyle medicine physicians would love to see governmental organizations do is not just recommend washing your hands and social distancing, but making strong recommendations for saying, hey, listen, you're stuck at home now. It's time to cook, no ordering out from restaurants. Let's eat more plant-based and reverse some of these chronic diseases, because we're not going to be able to avoid everybody getting COVID. However, if you do get it, you want to be in the best position to be able to survive it and overcome it. So losing the weight, eating clean, so you can say you're no longer diabetic, or you reversed your hypertension, or you're on the process of reversing your heart disease, that would be super important. Research has clearly shown over decades that if you get influenza, a big infection that causes inflammation, it can clearly trigger heart attacks, acute coronary syndromes, and strokes, because influenza triggers inflammation in your whole system, which can destabilize a plaque in your heart or in your brain, because atherosclerosis, the clogging of arteries with cholesterol, it is an inflammation process. So if influenza can do it, it just makes perfect sense that COVID would do the same thing, that it would cause an inflammatory state that overacts your immune system trying to fight off the virus, but as a cross reaction can trigger a heart attack or trigger a stroke. And so it's very clear that heart disease is one of the major predisposing factors for bad outcomes with COVID. What we need to focus on in our efforts against it is not which drug you can take, hydroxychloroquine, all these other things, and certainly don't inject any disinfectants, please. However, what we need to focus on is eating clean and doing the right lifestyle choices so we don't have those chronic diseases which predispose us to negative outcomes.
I see. So that's what is happening. The inflammation, who knows, is triggering the plaque to travel, and that is contributing further to the strokes and
Yeah,
other heart-related blockages.
absolutely. You can think of it that way. And the other side of things that you hear people talk about is trying to eat healthy to boost your immune system. And I think we got to be a little cautious about things like that. First of all, the terminology boost your immune system isn't really a good terminology, because you don't want an overactive immune system, because too overactive actually can worsen things, because a lot of the pulmonary complications is from your immune system reacting too much, what we call a cytokine storm. However, what you want is an ideally balanced immune system that's ready to react in the proper way. And certainly eating processed foods and sugar and animal-based foods cause a negative effect on your overall immune system health. So the more plant-based you can get, the better it's going to be to keep your immune system in a healthy state.
I see. Now, it's very hard for people to move from what they're eating to completely change the side and go to whole food plant-based. Even if they start doing the transition, let's say 20%, 30%, that whole meatless Monday movement type of, maybe just one day a week, will it have some effect, if not 100%? I mean, is it still, or is it all or none?
Well, so that's a great question. And there's a difference between what we theoretically would think is right versus what the evidence in the current publications and scientific journals have shown. There's not a lot of solid published randomized controlled trials investigating, what percentage of calories from plant-based foods do you need to prevent a heart attack or a stroke or lower your risk the most. But what we do know, based on observational studies and other populations, is that the general concept is the higher the percentage of calories that you get from unprocessed plant-based foods, the lower the risk of you developing chronic diseases. So basically, if you look at what the USDA says that Americans eat, the average American gets 12% of their calories from unprocessed plant-based foods. 12%, that's dismal. That's nothing. That's so minimal. 25% is animal-based foods, and 63% is processed foods, either sugar, white flour, refined grains, or processed oils. 63%, that's a standard American. So when you look at the longest living cultures in the world ever, they're averaging 95% of calories from unprocessed plant-based foods. So even if you think, hey, I'm not eating meat, I'm vegetarian, I only have a little bit of oil in my diet, whatever, if you really examine what percentage of calories came from unprocessed plant foods, a vegetarian might only hit 50%. They're nowhere near that 95% that the blue zones, those longest living cultures, were really achieving. And the data on heart disease reversal, you're 100% of calories from unprocessed plant-based foods. Wow. The data that PCRM and Neil Barnard put out, which has been the strongest to improve diabetes control, is 100% plant-based. And the best weight loss data, called the broad study, showed 100% plant-based is the best way to lose weight. It wasn't 90% or 80%, it was 100%. So the closer you get to 100%, the better you're going to be. Whatever step you could take in that direction is going to help you. But the solid data really shows you got to at least hit that 90-95% mark before the magic really starts happening.
Okay, that's perfect. So that takes me to a question that I received from my patient the other day when she found out that I will be talking to you. She said, I'm of Eastern Asian background and everybody in my family is thin but have high cholesterol and heart issues. And we are born and brought up as vegetarians. So she's not obese. I mean, I have seen the entire family. They are not obese. They are not even overweight. They are more little bit on the thinner side. So what, so that is a bit confusing for the people to understand that, hey, you are saying obesity is a risk factor, but I'm not obese. I'm a vegetarian.
Yeah.
Why
So I guess that's
not?
kind of, so I'll separate that into kind of two different questions. One is does your weight always correlate with your risk of heart disease? If you're thin, does that mean you're automatically protected? And the second is vegetarian the right way to go, or does that always protect you from developing heart disease or high cholesterol? So there's going to be a population, a percentage of people that could eat whatever they want to, and fortunately they don't get overweight or obese. However, maybe they look good on the outside and they're thin regardless of what they're eating, but on the inside they could still develop insulin resistance, high cholesterol, they could have hypertension, and so their whole circulation can still be damaged based on what they're eating, even if they remain thin. So the weight itself isn't the end all be all. It's great to be thin, certainly, and on average, people who are in the normal BMI range are going to have lower risk, but that is not something that will completely protect people from developing cardiovascular disease. I could give so many examples of that. But going to the more important part of the question is being vegetarian enough to protect you? And the answer is absolutely no. Like as we were previously saying, some vegetarians might only get 50% of their calories from unprocessed plant-based foods. It's great if you don't eat meat because there's a lot of inflammation, a lot of issues that happen, cholesterol, saturated fat from red meat and even white meat and fish. However, vegetarians could still be consuming eggs, and eggs are the #1 source of cholesterol in some surveys in the American diet because egg yolk is so high in cholesterol. And you could still be vegetarian and consume a lot of white flour or oils and sugars, which are very harmful to cardiovascular health, and ghee, which a lot of Eastern, Indian culture uses as a substitute for butter, is extremely high in saturated fat and dietary cholesterol. And actually, many studies show that when you compare ghee to the traditional butter, it is more highly oxidized and produces more of what we call free radicals, which damage our system more so than regular traditional butter does. So unfortunately, being vegetarian is not enough to protect you. 40% of India is vegetarian, yet heart disease is all over the place.
All over, really?
Yeah, it is. So it really, if you looked at people who are not only vegetarian, but went whole food vegan, whole food plant-based, at least 90-95%, that's where you're going to see the magic. And it also comes down, another way of thinking about it is a great valid statement based on sound research that actually the USDA got right in their dietary guidelines. And what that is it says they did not set a limit for how much dietary cholesterol is safe for somebody to eat. They did not set a limit for how much saturated fat is safe for anybody to eat. And the reason is any amount of cholesterol in your diet and any amount of saturated fat in your diet, any amount above zero, even a little bit, will raise your LDL cholesterol number, any little bit.
Wow.
And so if you are vegetarian, you're still consuming significant dietary cholesterol and saturated fat, which will raise your cholesterol numbers up. So while there is a lot of what we call individual variability from person to person in regards to how their diet can affect their blood cholesterol levels, when you get to 100% plant-based, you're not consuming any dietary cholesterol and your saturated fat is near zero when you're whole food plant-based, especially when there's no oil in the diet, you're going to see those cholesterol numbers plummet. And that's the ideal situation, which most vegetarians aren't that way.
So I just want to make it clear to our audience is that we are saying here that the oils, even though those are high polyunsaturated, monounsaturated oils with supposedly zero cholesterol, like olive oil and sunflower seed oil and grapeseed oil is not a good uh, is not allowed, allowed to be part of a whole food plant-based diet if somebody has a active heart disease or is
Absolutely.
trying to prevent.
Absolutely. And there's two different ways to think about it. One is just using a general concept, the fact that oils are in and of themselves highly processed. So oil is not a whole food. It takes 43 olives to squeeze all the fat out to make 1 tablespoon of olive oil. So that's just a general concept. However, when you look at the nutritional value, olive oil is still 15% saturated fat. And we said any saturated fat will raise your LDL cholesterol, any amount above 0. And so if you are consuming other oils too, coconut oil is extremely high in saturated fat, palm oil is extremely high in saturated fat. If you're consuming other oils, you're going to be raising up your LDL cholesterol numbers. And a lot of studies have also shown most types of oils cause dysfunction of the lining of our arteries called the endothelium as well. So there's many different reasons why oil is not good for you. Why do people think olive oil is good for you? Well, the research usually compares getting fat from olive oil to getting fat from butter or animal fat. And when you compare the two, yeah, oil looks like it's better than animal fat or butter, but that's like giving people arsenic and giving them cyanide. Look, you give people cyanide, they die real quick. You give people arsenic, hey, they don't die so fast. Arsenic must be good for you, right? Let's give everybody arsenic because they didn't die as fast. No, arsenic's not good for you. It's just less harmful than cyanide, that's all. So really you'd want neither arsenic nor cyanide. So you don't want the animal fat or the fat from the olive oils. So trying to get as low fat as you can on a whole food plant-based diet is technically ideal.
That's a very good explanation about, because that always gets people, I'm using refined oil or vegetable oil, and it's a false perception that they have about that they are eating healthy.
And so I tell them it's kind of like somebody saying they're smoking a filtered cigarette. It's like, yeah, but you're still smoking a cigarette.
Or now vaping, vaping is taking off. Oh,
right.
I'm vaping. Well, I don't know. Again, it's a cyanide and arsenic situation here.
Yep, absolutely.
One last question about keto diets. Oh my,
Yes.
I am begging people to go off of keto, at least start transitioning out. If they are done with their kickstart for weight loss, if they have done it, I said, good, you have lost weight now, let's start transitioning. And just before our podcast, I had a patient with a keto, and I have my little tubes here of fat, and this is how much fat is in 3 ounces of roasted chicken.
Oh my.
Skinless chicken.
There's a lot of people don't realize it, how much fat is
like, no, but she kept saying, I'm eating skinless chicken, I'm eating skinless turkey or whatever, low fat. I said, it still has this much fat.
So exactly, actually, chicken 100 years ago supposedly was only like 10 or 15% fat. Now it's 25% fat because of all the genetic modification of the animals. But in regards to the ketogenic diet, the reason it's so popular is because it's more aligned with our culture, it's more aligned with the food that our food system provides us, and you can get rapid weight loss, right? Yeah. But do you know what else could cause rapid weight loss? Going on a cocaine binge or getting chemotherapy, right? So if I gave somebody chemotherapy, they wouldn't be able to eat, they'll throw up, and they're gonna lose weight. Does that mean that a cocaine binge or chemotherapy is good for your health? Absolutely not. And especially when you think about, is it good for your health in the long term? Because what you need to focus on when you're thinking about what kind of a dietary pattern you want to have is, what are you going to maintain for the rest of your life that's going to keep you healthy and free of chronic disease? So it doesn't make any sense that if you eat a single apple, one apple, which is, an apple a day keeps the doctor away, right? But if you eat one apple, you're no longer on a ketogenic diet because there's just too many carbohydrates in an apple. You can't eat many different types of vegetables and most fruits. So automatically it's a red flag that this cannot be a good healthy diet in the long term. And that's actually what the research shows. In the short term, you get weight loss, which improves biomarkers. Like some people's blood pressure gets better, their diabetes number gets better, they lose weight. And so they think, oh, this is great. Look at my numbers are getting better. But in the long term, we know cardiovascular risk is significantly higher because of all the red meats and processed meats most people consume with the ketogenic diet. Cancer risks are much higher. So again, you don't want to do something for short-term benefit. You need to do it something that's good for the rest of your life. So learning the skill of a healthy diet, predominantly or exclusively plant-based diets, what you want, and do it right away. There's no cheating. There's no quick fix like doing a keto thing. That's not right. That's not good for you, because the second you go off of keto, you're going to gain it all back unless you learned the skill of how to eat a healthy plant-based diet, which you need to do right away from the start instead of trying to take some kind of a shortcut. And even though there's not a lot of published data on it, I could tell you anecdotally, and other lifestyle medicine physicians will tell you, I've had young, healthy people go on low carbohydrate or ketogenic diets similar to Atkins diets and have strokes or heart attacks, have events, even though they didn't really have risk factors. We see that happening. And so there's no major organization that recommends as a primary approach to any disease a low carbohydrate or a ketogenic type diet. It's just not something that we should be doing ever at all.
Yeah. Okay, Dr. Lome, let's say I come to your office with clogged arteries and with some weight problem, and what would you write on your food prescription pad for me? Give us
So
give us
that
a,
is a
give us the
great
best prescription and a pharmacy to go to.
So that's great. So the pharmacy, spelled F-A-R-M, pharmacy, is the one that you want, right? Not the P-H-A-R. Yeah. So, that's an interesting question, because every person is individually different. And as a physician, I see a wide variety of different people in different situations with different skill sets, different home situations, and different abilities to be able to make changes. I have many people who I just beg them, please just eat one apple a day. Please just try oatmeal once for breakfast. Please, that's all I want you to do. And I have other people that are saying, Doc, I am ready to do whatever you want. Tell me what's perfect, and I'm going to go in my pantry, throw everything out. And so it is quite variable from person to person. However, most people are somewhere in the middle. They get it. They want to make changes. There's just so many barriers that they have to overcome. They have their spouse, their family at home, learning a new way of cooking despite a busy lifestyle, trying to get over their taste preferences, which have grown up for many, many decades, eating a certain way. And so really individually, I have to kind of see, what do I think this person can handle? I ask them the questions, what are your goals in life? We could take two approaches. We could take the lifestyle medicine approach, or we could take the typical, I just give you medications and keep our fingers crossed that you don't have a heart attack or a stroke approach. A lot of people try to combine the two. And so I certainly try to gauge that and ask them, after we have a nice long discussion about how important it is to treat the cause of a problem, how important nutrition plays a role, how damage of the endothelium, controlling cholesterol numbers, staying physically active, not smoking, all those things. And then we kind of gauge, okay, how far in are you willing to go? And so if somebody says, oh yes, I'm willing to try this, I want to eat healthier, then I do not only have a huge printout of resources, which is on pbnm.org/resource, food delivery services, websites, books, all that stuff. But I frequently will tell them, ask them, what do you like to eat? What do you eat for breakfast, lunch, and dinner? And we try to work through, hey, if you normally eat this for breakfast, why not switching it and getting rid of the dairy milk, try an almond milk or soy milk for now, and just go through each thing. Oh, you like burgers? Well, why don't you try this black bean burger recipe? It's phenomenal. I'll write things out for them and point them towards specific. And I'll make a little note in the medical record system, what recipes we talked about, and I'll say, hey, I'm committing you. You got to try this. And then the next time they come around, I say, hey, how was the black bean burger? And so, and some people are highly motivated and take it upon themselves. And I tell them, you have to take this upon yourselves, because we're not going to, the healthcare system doesn't support you in making these changes. And our culture is not going to support you. And our food system is not going to support you. You have to support yourself for this, which is unfortunate. I wish that wasn't the case. But I guide them as much as I possibly can. I'm frustrated because I only have 15 minutes with most patients, and there's only a limited amount of stuff you could discuss in a 15-minute time period. So you do the best that you can with each person. And, I let them send me messages or shoot me emails if they have specific nutrition-related questions. But a lot of that stuff is available online on YouTube or, through Forks Over Knives and such. So if you're saying what an important distinction is when I have a heart disease patient in front of me, is somebody in a dire situation where they need to completely reverse heart disease? So they need to go all in. Do they need a bypass surgery, and they're refusing a bypass surgery because they don't want somebody sawing their chest open and taking veins out of their legs and doing this huge thing? In those situations, you got to go all in on like an Ornish, Dr. Dean Ornish plan, or one like Dr. Caldwell Esselstyn, who wrote a great book called Prevent and Reverse Heart Disease. 100% plant-based, no oil, and the percentage of calories from fat has to be around 10% of calories from fat. And those are the people in dire situations. Other people who maybe just had a heart attack and they're trying to be healthy, do they need to go that detailed and that low fat plant-based. They don't necessarily have to. It's still a great goal to try to do, but try to get your fat calories down to 15% or at least 20% or less while eating a whole food plant-based diet. And so that's really the only distinctions I make with heart disease patients do you need to go all in for sure, or can we be a little bit more lax about it? Because I'm not sure if you're going to be able to stick to 100% Dean Ornish or Esselstyn type strict plan. Let me give you a little leeway to allow you to be more successful.
Okay, perfect. So thank you for that prescription, Dr. Lome. Thank you so much for taking time from your busy schedule. Your talk is so timely as we exit out of this COVID crisis slowly but surely. And I hope the conversation around diet, nutrition, work-life balance to manage chronic disease conditions will prevail. I think a lot of people have become more and more aware that nutrition has something to do with what is going on, and I hope people are becoming more mindful. I see them being more mindful. I hope that thought will stay in our brain for a long time to come, and we won't go back to our old ways and habits and again become mindless and careless about how we take care of ourselves and planet. So I want to thank you again, and I know you are a founding member of a plant-based nutrition movement which started in Chicago and which is spreading across the country as well, I believe. And I know you are a frequent speaker there. I'm doing a Facebook Live with a cooking class next month.
Great.
So it's been a pleasure to have known you for a while, and I thank you again. And
yeah, and I thank you.
My best to you.
And I thank you for everything you do, because as you know, the only way we're going to make a difference and change our system and change the health of America is for people to actively step up and do something about it, spread the word, and show people how powerful lifestyle medicine can be. Because right now, the big money interests in our current culture is so dominant that it feels like it's such a challenge to overcome that. But we can overcome it, just like we've overcome tobacco and other major health crises. I feel like this COVID thing is a golden opportunity for us to make changes with these meat packing plants going down. This is our chance to really say, listen, we need to re-examine the food system, and we need to make it healthier, because it'll help our healthcare system, the health of America, not to mention the health of our planet, et cetera, et cetera. So no, thank you so much for what you do, and keep on doing it and spreading the good word. And hopefully I'm going to keep doing it together. I hope before my career is done, we're going to see a major shift
I think we will. I think we are at a right point, and I have a lot of hope from young people, the millennials and younger, the Generation Z's as well, because they are more active. They are seeing, they don't want to be sick, and the hospital food system and school food is another area of passion for me, and maybe we can try something to clean that up. But yes, thank you again, and my best to you and your family.
Thank you very much.
Yes, bye-bye.
Bye-bye.